have with us Dr. Swetha Damacharla, who specializes in internal medicine and diabetology at Magnet Hospital, Yusufguda. Most misused weight loss trend.
When you think about quick weight loss, it is so high GI index foods are really bad.
How often do you see people using CGMs right now amongst your patients, and is it becoming mainstream?
There's not much awareness about CGMs as of now, but
So what makes these drugs so effective in weight loss?
usually diabetic medications lo kuda there are dose escalate చేసే కొద్దీ ఈ సైడ్ ఎఫెక్ట్స్ వస్తాయి. అలాంటప్పుడు ఏం చేస్తాము అంటే
Obesity is now classified as a chronic disease.
ఫ్యాట్ పెరిగిపోయినప్పుడు ఏమవుతుంది అంటే there is a level of
Is it possible to be thin and have high blood sugar levels?
so that is quite dangerous.
What do you wish more patients knew before starting these anti-obesity medications?
2021 statistics prakaram there are almost people ask me rice tinacha or can I have these kinds of food. I'll be like, try out something.
So it's like a reward that they get. If they diet and exercise, next month I'll give you the medication and then
Yes,
you can
maybe.
further lose weight.
Yes.
Welcome to another episode. We have with us Dr. Swetha Damacharla, who specializes in internal medicine and diabetology at Magnet Hospital, Yusufguda. Welcome, ma'am.
Hi.
She is here to share with us what is new with chronic conditions like diabetes and obesity and how we can manage them. So let's dive in. Most people think diabetes is just a blood sugar problem, but nowadays we are finding out that it's a deeper metabolic issue.
Yes.
So can you tell us more about it?
So basically people oversimplify diabetes as just the sugar problem, but it is a chronic multi-system disorder starting from the course of the disease or pathogenesis of the disease till the complication. Not just one sugar issue is involved, but there are so many other things that are involved in it. Just for example, if we talk about the pathogenesis of diabetes, so it starts off with insulin resistance. So insulin resistance valla there will be beta cell overfunctioning.
Can you tell us what is insulin resistance to start with?
So insulin resistance is basically, insulin is a hormone which brings down the blood sugars. A cell should be sensitive to insulin to take in the glucose into the cell. So if the cell is resistant, so food తిన్న తర్వాత షుగర్ ఇంక్రీజ్ అవుతూ ఉంటుంది కదా, ఈక్వల్లీ యువర్ ఇన్సులిన్ ఆల్సో షుడ్ ఇంక్రీజ్ అండ్ బేసిక్లీ బ్యాలెన్స్ యువర్ బ్లడ్ షుగర్స్ అనమాట. ఇన్సులిన్ రెసిస్టెన్స్ ఉంది అంటే ఫర్ ది అమౌంట్ ఆఫ్ షుగర్ దట్ యుర్ ప్రొడ్యూసింగ్ యూ విల్ హ్యావ్ టు ప్రొడ్యూస్ మోర్ ఇన్సులిన్ టు హ్యావ్ ది ఈక్వల్ ఎఫెక్ట్ యాజ్ ప్రీవియస్లీ. సో మీ ఇన్సులిన్ సరిగ్గా పనిచేయట్లేదు ఆర్ ప్రొడ్యూస్ చేసిన అమౌంట్ సరిపోవట్లేదు అనమాట. సో దట్ ఈస్ కాల్డ్ బేసిక్లీ ఇన్సులిన్ రెసిస్టెన్స్. And so basically what happens when there is insulin resistance, your body is producing more insulin to bring the same amount of effect. So appudu em avutadi, your body is producing more insulin and your beta cells are the cells that actually produce insulin which are present in the pancreas. So they overwork. They're overworking day and night, in and out. So appudu em avutadi ante at some point of time your beta cell it will give up. So that is called beta cell dysfunction anamata. So appudu em avuddi, so the beta cell gives up and there is no insulin produced and then there is nothing to take care of your high sugars in the blood. And that is one thought process. The other one is because of visceral body fat or abdominal fat పెరిగిపోయినప్పుడు ఏమవుతుంది అంటే there is a level of chronic low grade inflammation that is going on within the body. So dani valla there are certain cytokines antam anamata, they are produced. Those indirectly cause insulin resistance. And again insulin resistance again cause beta cell dysfunction and diabetes. So it is not just about plain increase in sugars. There is high sugars, there is high insulin, there is high free fatty acids in your blood, there is oxidative damage, there is chronic inflammation. So it is just not plain, oh I just have high sugars. It is not that. And Because of all of this, there are a number of systems, organs involved in diabetes and starting from your brain, your heart, your kidneys, your reproductive organs. They're all involved because of these things that are going on.
And of course, the pancreas.
Yeah.
Those are the ones that produce the insulin.
Insulin.
Okay, okay. So all these systems are
It is
affected.
not plainly your blood sugars. It is about the entire body that is involved when it comes to diabetes and
What are the early signs of insulin resistance?
There are certain signs for insulin resistance. First, starting off with acanthosis nigricans, it is basically this velvety blackish discoloration at the nape of your neck, your armpits or groin region. And the next thing is skin tags, abdominal obesity or pot belly, and PCOS in women, and also fatty liver. We've been listening to fatty liver quite often these days. So that is also one of the signs for insulin resistance.
So all these people are at a risk for diabetes.
Yes, yes, absolutely. Insulin resistance is only the early stage starting point laga anamata. So eventually, if you don't take care about your health, lifestyle, stresses and all that, you will land up with diabetes.
Obesity is now classified as a chronic disease, but in some cases it's just not a lifestyle issue but like a medical condition is what we keep hearing. So can you tell us more about this?
Yes, absolutely. Now we consider obesity as a disease process rather than, you know, how I look or what is it my lifestyle or anything. The reason behind it is obesity has a lot of implications on your clinical health, psychological health or mental health, and generational health also. So
Generational health is the
as in reproductive
health of your children.
Yes, yes. Okay. It is found that almost 229 odd diseases are caused by obesity. When we come to medical implications, there is type 2 diabetes, the obesity nunchi diabetic avadamu. There is eventually cardiovascular diseases or cardiovascular deaths. There is fatty liver. Fatty liver, it's not just fatty liver, there is progression to even cirrhosis or end stage liver disease also. And for infertility, PCOS, Alzheimer's, there are so many other implications with obesity. And when it comes to psychological or mental health, depression, anxiety, and mood disturbances, all of these also are implications of obesity. And when it comes to generational health that we're talking about, low birth weight pillalu puttadamu, or kids born with high birth weight, and kids having obesity or type 2 diabetes, ivi kuda are expected anamata.
The cause is still lifestyle, or there are causes that are not in the person's control?
Most importantly, lifestyle, but also genetics. Your genetics play a role. And I'll give you an example for that. There is something called thrifty genotype or thrifty phenotype anuntade, where let's say most of the South, we come under like South Asian population, the Indians. Emautadi ante all throughout Indians or certain population or hunter cavemen etla unde vallu ante, they had bouts of food surplus, and then they had a prolonged time of drought, famine, or food was not available then. So appudu, how does your body accustom to it? Whenever you have food surplus, try to store. Okay, store in what forms? Your abdominal fat, fat around the liver, visceral adiposity antam anamata. It will around all the organs. So అట్లాగా అలవాటు అయిపోయింది ఏది ఇన్ ద జీన్స్, అండ్ ఇట్ ఈస్ passed down to the generations. But now because of urbanization and all that, we have food excess. Okay, so and also with all the logistics becoming easier, we have food surplus. We can eat how much ever we want.
There's a calorie surplus
basically. So the effect is not that we have genes which are trying to store the entire food and as energy, but we're not in that drought and famine phase where during those phases your energy is spent or your fat is spent. So when I'm talking about genetic makeup, this is what I'm talking about. Genes are all, genetic makeup is also responsible for the obesity. Hormonal imbalances are also responsible for the obesity. But when it comes to the percentage wise, most commonly is because of our sedentary lifestyle and the diet choices.
Is it possible to be thin and have high blood sugar levels?
Yes, absolutely. That is the scenario that we see in Indians. We call thin obese. We are thin on the outside and fat inside. So usually Indians have their BMI might be normal, but they have something called abdominal obesity or truncal obesity anamata. So because that is one of the risk factors that I told you about for insulin resistance. So eventually they'll end up having diabetes.
And vice versa also is possible, right? Where somebody has obesity, but they don't have high blood sugar levels.
Yes, that's the first step. But eventually they might land up in diabetes because your body is compensating for all the insulin resistance and it might give up, and that's how people land up with diabetes and matter.
So people have to watch out for both being overweight as well as diabetes.
Yes. So we have a term nowadays called diabesity, since both of them have the same basis of or same pathogenesis, and they're both inseparable or come hand in hand. So we have to watch out for these both complications together. And also, all of them have a basic root cause of these lifestyle or diet and stress. Most of the chronic diseases come like a package, like diabetes, hypertension, and high cholesterol levels. So we better watch out if one person has one issue, they can land up with the other issues also. So better watch out for them, better get early tests and get early diagnosis and treatment for the same.
Because you're recommending that people get early testing done, we've been hearing about the continuous glucose monitors, the CGMs that are in the market. How have they been helpful?
For me, they're a boon. From a physician perspective, so it is easier for me to track their glucose levels. And nowadays, basically, how do we do glucose monitoring? It is about fasting sugars, postprandial sugars, and 3 months average HbA1c we call it. So they're much more refined parameters are time in range and glycemic variability. These glycemic variability and time in range can be only assessed with a continuous glucose monitoring. I'll talk about glycemic variability. So it is not just those particular values that are important, it is the variability during the intraday excursions antam anamata. So within a day, meeku enta excursions, ups and downs avutunnayante, that is bad. Okay, you should have a very plateau or stable blood sugars that are going on. Enduku, why is this important? Ante glycemic variability can also lead to microvascular complications that happen in diabetes anamata. I can only check that with the help of a continuous glucose monitoring. And there is something called time in range. Time in range is something where, okay, in 24 hours, what is the percentage of time I'm within the normal range? Okay, so this should be more than 70%. These are a little sophisticated and more refined ways of glucose monitoring or checking your glycemic values. So that is one thing. And the second thing when it comes to is when a patient comes to my OP and then we have the entire chart and graph. So it is easier for me to discuss with them. Okay, you've had a spike here. So did you eat something? What did you eat? So they might say, oh, I just had a gulab jamun and all that. So I'll be like, see, I can in real time tell them this is what is happening to your blood sugar, and positive feedback, motivation, and all of these, it is quite helpful for me from a physician's perspective. When it comes to a patient's perspective, they are able to, in real time, monitor their sugars.
So there's an app, is it? They can constantly see the graph.
There's an app, and they can check their sugars, etla avutunnayi and all that. And
so just for clarity, the CGMs are these little patch sort of things that are connected, I mean, to your blood vessel?
They're these sensors. They have a very tiny, very small needle, probably a hair diameter low. So they attach it to your body. Usually lasts for about 2 weeks, and that takes the interstitial blood glucose value anamata.
And all of the data is captured on your app.
Yes.
And this is something we can do at home, or do we have to come?
No, you can do it at home. You can just buy it off the counter, get a CGM and fix it. And it is quite easy for somebody who uses a smartphone.
So the placement doesn't matter?
No.
Are we hitting a blood vessel or anything like that?
No.
Okay.
Absolutely not.
Okay.
Yeah. So it is
So
quite
it's very
safe.
easy to use, to just get on it. But I did hear that it's a little expensive.
I guess for 2 weeks, each sensor is going to cost you around 5,000 to 6,000 based on the brands and everything.
Okay.
So, but when it comes to the strict glucose control and what positive things that come out of it, if you invest for at least couple of weeks, you will know, okay, నేను ఈ ఫుడ్ తింటే నాకు షుగర్స్ ఇట్లా పెరుగుతున్నాయి, సో లెట్ మీ కట్ డౌన్ ఆన్ దాట్ ఫుడ్. నేను ఎక్సర్సైజ్, లెట్స్ సే ఐఎమ్ ఎక్సర్సైజింగ్ ఫర్ 30 minutes, నా షుగర్స్ ఆర్ మచ్ బెటర్. సో ఇఫ్ దే హ్యావ్ అ బేసిక్ ఐడియా, ఆర్ సంబడి ఇఫ్ ఐ స్టార్టెడ్ ద పేషెంట్ ఆన్ ఇన్సులిన్ కొత్తగా, I cannot tell you ఎంత డోసేజ్ వాళ్ళకి సరిపోతుందో అని చెప్పేసి. దెర్ ఆర్ ఛాన్సెస్ దట్ దెర్ మైట్ బి గ్లూకోజ్ డిప్పింగ్, సో హైపోగ్లైసీమియా అంటాం అనమాట. సో దట్ ఈస్ క్వైట్ డేంజరస్, అండ్ అలాంటి వాటికి ద CGMs యూజువలీ హ్యావ్ ఎన్ అలామ్. సో వెన్ ద పేషెంట్ నాక్టర్నల్ హైపోగ్లైసీమియాస్ అవుతూ ఉంటాయి, అప్పుడు ఏంటి పేషెంట్కి తెలియని కూడా తెలియదు వెన్ హీ స్లీపింగ్. సో అలాంటప్పుడు దే హ్యావ్ ఎన్ అలామ్ అండ్ దే కెన్ they'll get a prompt notification saying, hey, check your sugars, they're quite low, or have something, it's quite low. So alarms are quite useful with CGMs. And for until and unless oka నాకు ఇంత ఇన్సులిన్ సరిపోతుంది, ఇట్లా టైటర్స్ వచ్చేసినాయి అని అంతవరకు యూజ్ చేస్తే సరిపోద్ది. బట్ ఐ రికమెండ్ పీపుల్ యూజ్ CGMs because they're quite useful.
Also, I think you can know your portion size also,
Absolutely.
like what is working for
Absolutely.
you, what is okay.
I usually tell the patients, I educate them about glycemic index. So what is glycemic index? If you take a carbohydrate rich food, and how faster your sugars increase, how faster your blood sugars increase. So that's how we categorize low GI, moderate GI and high GI index foods. So high GI index foods are really bad, okay, like white bread, white rice, itlantivanni. Alanti emavutayante, like I told you about glycemic variability, if you have low GI foods, you will have a very consistent rise in your blood sugars. I usually, people ask me, rice tinacha, or can I have these kinds of food? I'll be like, try out something. One day you have a cup of rice and check your sugar values. The next day have a cup of quinoa or millets and check your sugar values. Valaki answer telsipoddi, they will be motivated, and I don't have to answer them what to take ani cheppesi. So practically they will know what to eat and what not to eat.
Okay.
So that is it is quite a powerful motivator, the CGMs.
And so basically, if the same person has little rice versus a lot of rice, is the spike much higher?
Portion size is absolutely important, because how much amount of carbs are you taking, what is the protein that you're taking, what are the vegetables that you're taking, absolutely important. But in the portion, let's say you're recommended 130 grams of carbs per day, dantlone differences. Okay, if you take white rice and if you take millets, or if you take quinoa, what is the rice that happens? So this are differences anni manaki CGM to telisipotu untayi. It will be more evident to the patient.
How often do you see people using CGMs right now amongst your patients, and is it becoming mainstream?
There's not much awareness about CGMs as of now, but as time progresses, probably, and also when a physician educates their patients, they are open to it, because I show them examples of other patients who have used a CGM and how useful it is, how helpful it is. They are open to the idea. And it is going to become mainstream probably. It will take time, but definitely it is quite helpful.
What do you wish more patients knew before starting these anti-obesity medications?
they should know is మా సైడ్ నుంచే కాదు వాళ్ళ సైడ్ నుంచి కూడా వర్క్ ఉండాలి in terms of maintaining good diet and exercise. So don't be in a notion where, you know, oh, I'm taking these medications and I'm going to have a good weight loss. That is not going to happen. You have to work for it. And once you stop these medications and again go back to your usual lifestyle, the usual lifestyle, they're going to have a rebound or bounce back of the weight.
So these weight loss medications only assist in losing the weight.
Yes,
You have to,
yes. They're
in
always
addition to.
they're always an adjunct, not the like we've started it off as they're not always the quick fix or they're not the permanent fixes. They are, it's only a pathway to a long-term health.
So anti-obesity medication was making headlines around the world, and now they're in India, like Mounjaro, Wegovy. So what's the impact that you foresee?
Yes, firstly, India ranks third in the number of people affected with obesity, and 2021 statistics prakaram, there are almost 25 crores of people with generalized obesity and 35 crores of people with abdominal obesity. So since we've talked about how obesity has lots of implications on the health, and once these drugs have come into the market, they're going to change the healthcare landscape. They're going to bring down the complications of obesity.
So you think it's a positive impact then?
Absolutely.
Having these
Absolutely.
drugs at your disposal?
Yes.
Okay. So what makes these drugs so effective in weight loss?
Usually diabetic medications lo kuda there are like weight neutral, weight gain medications and weight loss medications anamata. So initially they were used as diabetic medications, but since they had a very good effect on the weight, so now they have become mainstream weight loss and obesity medications anamata. And when it comes to how are they going to work anante, these work on the gut hormones. There is something called GLP-1 and GIP. So these hormones, they cause, they affect the brain. They reduce the hunger. They increase the satiety, ante fullness. And that's how they act on the brain. And they cause delayed gastric emptying, ante స్టమక్ ఎంప్టీయింగ్ని స్టాప్ చేస్తాయి అన్నమాట, డిలే చేస్తాయి అన్నమాట. సో అప్పుడు యూ ఫీల్ ఫుల్ ఫర్ అ లాంగర్ duration of time, so you don't snack in between and all that. And when it comes to pancreas, they cause increased insulin production and decreased glucagon production. So that's how they affect, like I told you about how obesity or diabetes is not just one thing. It affects all the other spectrum of the disease also. So that's how they bring down the weight, they bring down the sugar.
What kind of weight loss can a person expect by taking these drugs?
As per studies, they say almost 15 to 20% of the body weight.
Over how much time?
Over 68 weeks.
Oh,
These
6 to
are
8 weeks.
68.
Oh, 68 weeks. Okay. Okay.
So
That's like over a year.
yeah.
More than a year.
Yes. This in adjunct with diet and exercise. Because these medications will reduce your hunger and the amount of food that you're eating. But you, on the whole, is responsible for ఆ కొంచెం తిన్నా కూడా ఏం ఫుడ్ తింటానో is your responsibility. So that's why medications, ఇప్పుడు నువ్వు I'm going to continue the same old lifestyle, junk food and sedentary lifestyle, but still I'm going to take these medications and, you know, lose weight, and it is not going to happen. So it is always whenever I'm prescribing this medication, if somebody is in two thoughts, I'll be like, why don't you start off with lifestyle modifications first, see if you can do it. You know, have a strict diet, start off with exercise, at least like, you know, some moderate intensity exercise for few days and see if you're going to stick to it. If you are motivated enough to stick to it, let's start you off on these medications అని చెప్తూ ఉంటాను నేను.
So it's like a reward that they get. If they diet and exercise, next month I'll give you the medication and then you can further lose weight.
Yes.
But there's also the problem of not having enough nutrition in the body, right? I mean, your nutritional needs are not met.
Yeah, అందుకనే diet is quite important అన్నమాట. So whatever the food that you're taking, make sure you have like all the nutrients, vegetables, the amount of, you know, the daily recommended dose of vegetables and fats and fruits or carbs that you have to have. So that is quite important అన్నమాట.
Because you're having lower quantity of
Yes,
food, it
yes.
should be a
Yes,
well-balanced
yes,
diet, I
yes,
guess.
yes.
Makes sense. So what are the precautions that you take before prescribing these medicines?
Not many ఏమంటారు contraindications అయితే they're not many. Few are acute pancreatitis, somebody who had pancreatitis in the past, they're absolute contraindications, and somebody who had thyroid cancers, there is something called MEN syndromes అన్నమాట. అలాంటి వాళ్ళకి we usually don't prescribe. So before prescribing we ask all the history and then go about prescribing. But other than this, usually the patients do not have any side effects also. Side effects in the sense minimal effects, minimal GI effects like nausea, vomiting, and diarrhea sometimes. Again, these are all dose dependent only. So డోస్ ఎస్కలేట్ చేసే కొద్దీ ఈ సైడ్ ఎఫెక్ట్స్ వస్తాయి. అలాంటప్పుడు ఏం చేస్తాము అంటే యూ ఐదర్ రెడ్యూస్ ద డోస్ ఆర్ go back to the previous dose couple of weeks and then again increase the dose.
So your body just has to get used to the
Exactly,
drug.
tolerance.
So build up the tolerance
yes,
slowly.
Yes. That's why even these medications, either Wegovy or Monjaro, we usually start off with a lower dose anamata. People might not, I keep telling them, you might not see drastic changes in the first few weeks, but this is only for your body to build up the tolerance so that you will not have much side effects from it. So, and after that, 4 weeks tarvata, step up the dose. Next 4 weeks, step up the dose. That's how it is.
So these are the short-term side effects, Andy. Are there any long-term side effects as well?
Long-term side effects, you've heard about Ozempic face.
Yeah.
Disease. So usually there is fat loss. So people will have buccal fat untadu kada. They lose the buccal fat and they look old and all that. So that is why protein intake is much more important. Strength training is also much more important so that you will not lose your muscle mass also as a part of weight loss.
And internally, like with your organs, like failures or anything dangerous that might happen?
As of now, there is no data which indicates that there might be serious long-term effects.
Have you had any patients asking for these drugs when they don't really need them for quick weight loss?
ఇప్పుడు వరకు అయితే ఎవరు అడగలేదు, బట్ when you think about quick weight loss, they're not quick fixes, and what gives you a permanent solution is absolutely your lifestyle modifications. Even somebody who is on these weight loss medications, for their maintenance, lifestyle, diet, exercise is quite important.
And when you get off the drugs, you will put the weight back on, antarga?
Yes, అందుకనే we are acclimatizing the patient with diet and lifestyle so that they will religiously follow that. Even when you stop the medication, good lifestyle ki shift అయిపోతూ ఉంటారు so that they can maintain that.
What are the benefits of using these anti-obesity drugs?
First thing, they reduce your weight and they prevent all the complications that might happen with obesity. Like I've told you about cardiovascular disease, OSA, obstructive sleep apnea, fatty liver. So basically you're treating the main cause, so these are usually prevented. And the second thing is diabetes. This is the drug which was
Originally
for diabetes. And the third thing is there are trials which say that it has cardiovascular risk benefit. So any diabetes drug, when it is going under trials, clinical trials, they usual thing ఎంత పర్సంటేజ్ ఆఫ్ HbA1c తగ్గిస్తుంది, సైడ్ ఎఫెక్ట్స్ ఎట్లా ఉన్నాయి, దీంతో పాటు all the medications go under a scrutiny what benefit it is having for cardiovascular mortality risk benefit ఎట్లా ఉంటుంది అని చెప్పేసి they check అన్నమాట. So these medications are known to have, they reduce 20% of the risk for somebody who has established cardiovascular disease. So it's good for the heart also.
So what's stopping people from asking for this drug and using this drug?
The main barrier in India is the cost. So the dosage is, this is a weekly dose injection, and per month for a patient it might cost you around 16,000 to 20,000
Oh,
based
wow.
on what medication it is, Anjay, and what is the dose also.
That's expensive.
Yes. So that is the most important barrier for Indian scenario. But probably in the coming years, when the medications lose patent and all that, it might be a little pocket friendly, and many more patients can use these medications and reap benefits out of it.
What is your advice for someone who's tried many diets but has not lost weight and has lost motivation instead?
Don't lose motivation. We have newer drugs coming up.
Now let's talk about diabetes reversal. What is it and how can someone achieve it?
The technical terms when we put in diabetes reversal is something where a person's HbA1c goes below 6.5 for over a period of 3 to 6 months, but he's done this without any drugs or any surgeries. It's purely lifestyle modifications. So this is diabetes reversal.
What kind of diabetes patients actually have diabetes reversal and remission?
Yes. So this is also quite important. So, if a patient comes to me with 10 years history, long history of diabetes, and they'll be like, oh, can I reverse my diabetes? That might not be possible. That's because, again, going back to the pathogenesis where your beta cell dysfunction, your beta cell exhaustion happens over 10 years of time. So somebody who is type 1 diabetes, somebody who is long-standing diabetes, వీళ్ళకి కొంచెం tough ఉంటుంది to go back to non-diabetic state without using any medications.
So who's truly eligible? The people who've just recently been
Diagnosed of diabetes, and somebody
and who are
who's
borderline or something like that?
So somebody who has recently been diagnosed of diabetes, and somebody who is people who are overweight or obese who eventually land up in diabetes. So we can use strict dietary modifications and lifestyle to reverse the diabetes.
So can someone who's taking these anti-obesity drugs say that they had diabetes reversal?
It's a misnomer. When you see the definition of diabetes reversal, you are not using any medications. So it's only diet and exercise. With that, you have to reverse your diabetes.
So if a person has lost weight and got their diabetes under control, is there a chance for relapse?
Absolutely. There is chance for relapse. As long as you're not sticking to your diet and exercise, there will be relapse.
So in your practice, what was the most dramatic transformation you've seen for a patient?
There was this patient, he'll be in his late 40s, and so he came up with HbA1c of 12. So that's like very poor control of diabetes. So I gave him, like, he's a teacher. So I told him about, what are the complications that might come up if he still continues to have these sugars, and how diet and exercise play an important role in controlling the diabetes and all that. So after like probably a half an hour lecture, so the next time he came back, his sugars, like, with the same amount of medications that I was giving him, he had like hypos anmata. So every time he used to come for my follow-up, I used to bring down his, dosage, medications, number of medications, the dosage and everything. So eventually he landed up, taking just like 1 or 2 tablets per day. So I keep telling him it is not absolutely my doing or my achievement, it is all on him. Because diet and exercise play such an important role in controlling the diabetes. So it will reduce the number of medications that you're taking. It will, the dosage and all of these. So yeah, that is one memorable moment that I had.
You can use him as your shining example for all your other patients.
Yes, I keep telling them, I keep telling the other patients also, because because somebody with 12 HbA1c, they will be like demotivated and all that. Inta sugars unnayi and all.
What did the number come down to?
Good control is less than 7.
Okay.
The number came down less
To
than
below
7.
7. Okay. You should take a photo of his and put it in your office and be like, see, before, after.
There's one more patient that he came to the hospital. He got admitted in the hospital. Diabetes ki konni emergency complications vastayi when the sugars are like very bad and they're not controlled. So he landed up with DKA. We call it diabetic ketoacidosis. So that's a medical emergency, and the patient has to be treated in the hospital.
How does he know that he had?
Different symptoms ఉంటాయన్నమాట DKAకి. They have usually fevers, they'll have nausea, vomiting, they come with severe dehydration, and their blood pH levels fall, acidosis, ఇవన్నీ ఉంటాయన్నమాట. So the patient came, that's when he came to know that he's diabetic అని చెప్పేసి. So we've treated him, sent him off home, and with all these, he was so strict about his diet and exercise and taking medications. I've put him on insulin actually. But when he came back, absolute normal values. So for a very long period of time, he controlled in diabetic reversal అని చెప్పాను కదా, that happened అన్నమాట. He controlled his sugars with diet and exercise. So the next, after few months of follow-up, he came back again because he was not able to maintain his, because strict diet and exercise, and because of his work and everything, he was not able to maintain. So again, it remissioned. So I had to again put him back on medications.
What advice would you give someone who doesn't want to get on anti-obesity drugs and wants to do it naturally?
Like I've told you, even before prescribing these medications, I would just talk to them about how important diet and exercise for these medications to work. So, and also it builds up a discipline and motivation. So if somebody wants to do it in natural way, I would say go for it, absolutely. But monitor your improvements or monitor your weight loss. So if you're not able to achieve the weight loss that you wanted to, then obviously come back to us.
Great. That option is always open.
Open.
So let's get to the fun rapid fire part of the discussion. Anti-obesity medication in one word.
At present, a boon.
Okay. Most misused weight loss trend.
Not in India so far, but what I've heard in the US, it's Ozempic. And when it comes to Indian scenario, those weight loss belts, creams, and these kinds of fads that usually don't work, I guess.
Most misused weight loss trend.
Crash diets.
Food you ask all diabetics to cut down immediately.
Anything white sugar, white bread, white rice.
Biggest excuse you hear from patients.
I don't have time.
One rule to follow for anyone with a BMI over 30.
Eat right and move more.
And now we're going to talk about the myths, and you need to bust the myths. Weight loss injections are permanent fixes.
Absolutely not. Once you stop that, you're going to regain your weight back unless and until you maintain the other pillars of treatment, that is diet and exercise.
Karela juice can reverse diabetes.
No.
You can't get diabetes if you're under 30.
No. There are lots of my patients who became diabetic. But probably the mechanism might be different. There's something called monogenic diabetes. There's something called type 1 diabetes. So even type 2 diabetes also people are getting because of these drastic lifestyle and horrible diet that we are following.
GLP-1 drugs are safe for anyone looking to lose weight.
Yes.
Oh, that's the one non-myth that we have on here.
Yes.
Diet and exercise is enough, no need for meds.
For some people who are achieving their goals, but if you're not able to, then there are always medications.
So that brings us to the end of our discussion. Thank you so much, Doctor.
Thank you so much. I loved having this conversation, and I hope I can bring about certain awareness of what are the latest trends that are happening in diabetes, and so that the patients can also keep up with the latest technology and so many innovations that are coming up in this field.
Absolutely. Thank you so much.